everyone, I am Mary Priscilla, HOD of Food Nutrition and Dietetics. I'm here to deal with the topic Nephrotic Syndrome. So what's nephrotic syndrome? The other word for nephrotic syndrome is nephrosis, or you can call it as proteinuria. So nephrotic syndrome is a kidney disorder which causes the body to excrete too much of protein in the urine. So that is the reason it is called as proteinuria, excess concentration or waste excreted in the form of urine. So this disorder is caused by damage to the small blood vessels in the kidneys that are able to filter the waste and also remove the water from the blood. So symptoms, if you see, of this nephrotic syndrome, edema is seen or swelling is seen in the feet, limbs, ankles and the face of an individual, and also weight gain is seen due to the fluid retention and the urine is too much foamy. Treatment, if you consider, you can normally treat this condition with the blood pressure medication where your hypertension is elevated and also your normal water pills to remove the water from the blood is essential. Now let's see some of the symptoms of nephrotic syndrome. Here if you see tachycardia. Tachycardia means excessive rapid heart rate. Then edema. Edema is swelling of the limbs and the feet, and also you can see here on the face. Pale skin or fissures are seen, which leads to dermatitis, which is a skin condition. Then coming to vomiting, anorexia is seen, and then proteinuria, that is too much protein excretion in the urine. Hyperlipidemia, that is this condition would lead to, or the blood clots which are formed in the blood can lead to thrombosis, which can lead to increased hyperlipidemia or elevated blood cholesterol in the blood. Next, coming to, nephrosis introduction. It is caused due to a progressive glomerulonephritis. So glomerulonephritis is a condition where the glomerula is inflamed. It can be caused due to diabetes mellitus. Diabetes mellitus is nothing but increased blood sugar level, and lupus, which is immune system where the immune system attacks its own organs and functions of the body. Malaria, which is a type of infection which is caused by viruses or bacteria. Then due to drugs, too much consumption of drugs or nephrotoxins can lead to nephrotic syndrome. Then inhalation of heavy metals and toxic venom can be hazardous to health. Treatment requires diagnosis and management of the disorder which is responsible for proteinuria. Coming to the symptoms, as I already told, proteinuria, here if you see losses up to 5 grams in adults, the protein content, and 0.1 grams per kg in children. But when it exceeds 5 grams and 0.1 grams, it is considered to be proteinuria. Hypoalbuminemia, hypo means reduced protein in the blood. Peripheral edema, edema is nothing but the swelling of the body organs. Plasma albumin escapes through a leak in the glomerular membrane, and also plasma globulins, which is a type of protein, also leaks from the urine. Proteinuria leads to edema. Then the urinary losses of albumin and proteins leads to tissue wastage, which can lead to fatty liver, nothing but increased hyperlipidemia. Malnutrition, because a proper food is not consumed because of the condition, where the condition is so severe that the kidneys have to be rectified or it has to undergo dialysis. And increased susceptibility to infection. So if you see in such patients, infections are very attacking agent to the body. Principles of diet, if you see, you have to restrict protein, then high carbohydrate, restricted salt. Salt is restricted to prevent edema, and moderate fat with restricted fluid. Fluid restrictions are usually seen, which is highly recommended by a physician, the physician or the treating doctor. Vitamin supplements such as vitamin C could be given. This could be given in the form of supplements. The diet should be low in fat and also cholesterol. Coming to the dietary management. Dietary management is a basic necessity of an individual to recover this condition. To ensure protein use for tissue synthesis, sufficient energy must be provided. As you all know that proteins are used as energy purpose. Appetite is usually poor, due to which it leads to malnutrition. This has to be rectified. Weight loss or infection requires additional calories. So when a person is undernourished because of the condition, additional calories, like in case if it is 2000 kilocalories plus 400 to 500 kilocalories, you're going to recommend. Moderate protein restriction, about 0.8 to 1 grams per kg body weight, because increased protein intake effects on renal function. So this is the reason you're going to restrict the proteins. Daily dietary protein should come through the diet and also replace the nutrients or the proteins which are lost in the urine. Protein malnutrition is seen when the proteins exceed 10 grams per day. Diet should be low in saturated fat. Saturated fat is a type of fat which has got low essential fatty acids in it, and also it has got not more than 2 double bonds. So it has to be low in cholesterol and refined sugars to control the elevated blood lipids. Adequate calcium intake is necessary to prevent hypocalcemia. So this can be done through the diet and also by the calcium supplements. Potassium losses can be gained through potassium supplements. So this has to be done in a very mild amounts. Sodium is restricted to prevent the edema and prevent hypertension, already mentioned as above. Next, coming to the salt consumption, it is restricted to 2 to 3 grams per day. No salt is to be added while cooking or on table. As in, extra salts need not be added when a patient shows edema or swelling in the body. Restriction of fluid is necessary. So restriction of fluids, as in fluids are prescribed by a physician. If oliguria, so too much of urine is secreted, or frequent urination, you have to restrict the fluids. Coming to the first type of nephrotic syndrome is acute renal failure. If you see in this condition, there is a sudden shutdown of renal function. So the kidneys are already damaged. Here what happens, the renal function suddenly stops working. So high mortality rate, so death rate is too much high in this, and the condition requires a medical emergency. Causes, if you see, loss of blood flow to the renal, which decreases during accidents. So in case if you are prone to any kind of accidents or injuries where sudden blood loss takes place, so this can be a reason for it, or a simple hemorrhage, or at the time of delivery where you lose excess amount of blood from the body. Loss of blood is also seen in burns and crush injuries. Then fluids are lost. Fluids are lost during diarrhea or vomiting or any kind of diabetic coma. Then surgical operation where the blood is lost during the surgeries. Infections produces shock. So this infection also reduces the renal function. Acute hemolytic disorders, like where the RBCs are damaged. So here also you can see this condition has been triggered. Then consumption of nephrotoxins. So your simple drugs like Dolo or paracetamol can reduce the renal function. Then variety of mushrooms. So consumption of too much of mushrooms can also trigger your renal function. Nephritis or nephrosis, as I already told you about the glomerulonephritis, where the inflammation of the glomerular layer takes place, it can result in acute renal failure. Dietary management of this acute renal failure, if you see, energy about 600 to 1000 kilocalories is very much important or adequate to maintain the adequate requirements. High calorie intake is mainly from carbohydrates and fats. So usually energy comes through carbohydrates and fats. So proteins, foods containing proteins are stopped. You have to restrict the proteins. If you see too much of protein, urea is reduced. Protein content of diet varies depending upon the urea content of the blood. So protein is always correlated with the urea content of the blood. Carbohydrates, 100 grams per day is essential to minimize the tissue protein breakdown. And 2 liters of 5% glucose meets this. So in case if the patient is not willing to take any kind of oral diets, then you can start with intravenous feeding, where 700 ml of 15% glucose can be given through nasogastric tube. If orally, then you can give about 700 ml of glucose along with little lime juice can be given. Fluids. Fluid permitted here would be 500 ml plus the losses which is seen in the urine. So additional 500 ml in case the patient is perspirated or aspirated during the times of feeding. Sodium losses through urine is measured and replaced. So the sodium which is lost can be measured and it can be rectified immediately through the diet. Hyponatremia, where reduced secretion of sodium is seen, it can occur due to water retention. Then restriction of water than salt administration is indicated. So restriction is usually seen if the patient has swelling all over the body. Sodium is restricted based on the sodium losses on the urine. Potassium, hyperkalemia. Hyperkalemia means increased potassium in the blood. It has got effects on heart, so it's correlated with the cardiovascular diseases where it blocks the blood flow to the heart. So sources like tomato juice, coffee, tea, cocoa and potassium rich vegetables are avoided here. Then coming to hemodialysis. Hemodialysis is a type of dialysis where you transfuse the blood. It can be considered when the blood urea level is over 200 milligrams per 100 ml. Then the diet should be raised to 2000 to 3000 kilocalories and the protein is restricted to 40 grams. If patient cannot take oral feeds, then you can rely on the intravenous feeding, and also amino acid solutions can be given through intravenous feeding. Thank you.